So the 1916 polio epidemic had a huge impact on how crippled children's services were developed under the Social Security Act. This first polio epidemic was in 1916. It happened mostly in the eastern part of the country of the United States. About 6,000 people died from the epidemic, mostly children, and then an additional 30,000 children were afflicted with polio and needed major medical interventions. Because of the large number of children that were impacted, communities needed to respond differently than they had in the past. Typical responses to polio was putting a child into a hospital setting and providing surgical care. Well, with 30,000 children, it was just not possible. So communities got together and developed committees made up of social workers, doctors, nurses, charity organizations, philanthropists, and these committees raised money and organized medical responses to the polio epidemic. And these responses were very much individualized to the communities. So in rural areas, the surgeons went out in mobile rural units to those communities, provided surgery and medical care out there, whereas in the urban settings, they developed outpatient clinics. Rather than having children stay in hospitals, they just simply went to outpatient care. And what you see for one of the first times in the United States around healthcare is that social workers, doctors, and nurses are working interprofessionally to address the needs of children. So at the start of developing the Social Security Act in the 1930s, the experience from the 1916 polio epidemic really influences how the law is written. For example, in the 1960 polio epidemic, the doctors and social workers and nurses and charity organizations coming together to develop these aftercare committees, you see that written into the laws that go on to develop the Crippled Children's Services Program. So that experience of working together at the systems level to provide care for children really comes to life under the law of the Crippled Children's Services Act.